Namaskar, I am Dipak Aditya. I have a PhD from University of London, a CAPM from Project Management Institute, a black belt in Lean Six Sigma, a graduate certificate in Project Management from Queensland University of Technology, and a graduate certificate in Change Management from Victoria University, Australia. I have a great deal of interest in organizational change in any discipline, including health sector. I have created a video on organizational change in general practice with 6 chapters. I would like to present this video to you. Chapters of organizational change in general practice. The chapters are Chapter 1, Introduction to General Practice, Chapter 2 to 5, Functions of RACGP, Medicare, AHPRA, and Australian Medical Council. Finally, Chapter 6, Change Management in General Practice. Chapter 1, Introduction to General Practice. GPs are medical graduates, sometimes with higher degrees. They are the small business owner, work solo, in a group, or in the corporate structure, have bulk billing or private billing. GPs are Australian, Aboriginal, or international. All GP aim to have the credential of AHPRA GP and engage in CPD. They have concerns with risk management and litigation. Introduction to General Practice Continuation. Continuation Professional Development or CPD. The GPs must engage in CPD after RACGP. As you will find in the last section, Organizational Change in General Practice, there is a provision for CPD. GPs delegate and refer to a specialist. Introduction to General Practice Continuation. GPs should keep clear and accurate medical records for safety and risk management. Should cooperate in an investigation if there is one for GP. Introduction to General Practice Continuation. What are the risks in general practice? It is poor record keeping, forgetting documentation of consent, fail to follow up referrals and test results, and the most important, rush consultations with insufficient time. Careful risk management is essential. Chapter 2, Functions of Royal Australian College of General Practitioners. RACGP mission is to support GPs, general practice registrars, and medical students through education, training, and research, and by assessing doctors' skill and supplying professional development. Strategic Plan of RACGP. The 3 RACGP strategic priorities are delivering exceptional GP experience, advocating for quality, excellence in delivering world-class service, and the innovation and being agile. As mentioned before, in the change management plan, we have made provision of simple and strong CPD program for GPs, and also develop career and education planning for junior GPs. The roles and responsibilities of RACGP. These are setting standards for general practice, providing suitable educational resources, advise and supporting GPs, investigators, and educators. Work closely with AHPRA. Remember, the RACGP cooperate with the tribunal for the deregistration case. Fellowship program is a major one. Chapter 3, Functions of Medicare. Medicare is the backbone of Australia's health framework. Medicare allows visit bulk billing doctors free of charge. In mixed billing practice, a percentage of a GP's patient will top up on the Medicare allowance, which comes from the patient's pocket. Healthcare card. You can apply for a healthcare card if you are eligible. You will receive a discount when buying medicines. Eligibility of Medicare benefits. It is an Australian or New Zealand citizen. Citizens of Norfolk Island, Christmas Island, or Lord Howe Island, and anyone from a country with reciprocal agreement. Medicare Benefits Schedule, MBS. It covers 100% of the schedule fees and 85% of the specialist. You may have up to 3 PBS items on the prescription and only one authority required item. The PBS include 793 medicines in 2066 forms and doses and is sold under more than 5,300 different branded names. Medicare safety net. It provides a large rebate. There are three types of safety net. Original Medicare safety net is $495.6. Extended Medicare safety net general $2,249.8. Extended Medicare safety net with concessional and family tax benefit Part A is $717.9. PBS provides affordable medications to all those covered by Medicare. Bulk billing visit with a Medicare card, you do not have to pay anything. Concession cards are available as well. Medicare audit. Medicare audit is a challenge. In general, if you are on the 99th percentile of any Medicare item, you will potentially be audited. Prepare for the audit. It is presented in the next slide. Preparation for Medicare audit. Prepare by starting with the item numbers. Understand how many patients you can bill with that number. Understand the process of audit. You may be contacted if your usage differs significantly. Explain your position. You may have a large number of diabetes 2 patients. Show your diagnosis. You may have a large number of chronic disease patients in your area. Always maintain excellent communication. How can you be sure that you are billing appropriately? Consult the MBS regularly to ensure that billing is correct. Read the descriptors. Chapter 4, Australian Health Practitioner Regulation Agency, AHPRA. AHPRA works with 50 national boards to ensure a safe health workforce in all medical professions. AHPRA sets standard, audit compliance, manages compliance, and registers health practitioners. Chapter 4, Functions of Australian Health Practitioner Regulation Agency, AHPRA. AHPRA is a major stakeholder. Please see the AHPRA complaint model. Anyone can complain. It is a threat to GP. For simple complaint, it takes 3 to 5 business days. For complex complaints, 10 to 20 days to evaluate and investigate the complaint. There will be an external investigation if required. The National Health Practitioner Ombudsman and Privacy Commissioner NHPOPC will manage the review. Chapter 5, Functions of Australian Medical Council, AMC. AMC processes accreditation and peer review to promote high standards of medical education. Using the peer review process, AMC expert assessment teams assess the medical training programs against the approved standards. AMC portfolio. As you see, there are 6 steps in establishing an AMC portfolio. Submit the medical degree, create EPIC, establish portfolio, upload qualification to the EPIC, proceed on the standard pathway, and then the qualification will be verified. Establishing a portfolio for one qualification is $600 from January 2023. AMC conducts examination for international GPs for standard pathway only. There are multiple choice questions online with 150 questions. Failure to complete all 150 items will lead to the result being recorded as failed, insufficient data to obtain result. Questions are from medicine, surgery, gynecology, child health, mental health, and population health. The cost of MCQ exam is $2,920 from January 2023, and for certificate is $300. Clinical examination for AMC. The general objective is to assess clinical competence. Assessment criteria are related to medical, surgical, women's health, pediatrics, and mental health. The fee for national test center based exam is $3,730 and for online $4,130 from January 2023. Workplace based assessment is $1,000. Chapter 6, Change Management in General Practice. Organizational change refers to the change in culture, technology, infrastructure, or internal processes. Culture needs to be changed in general practice, especially for incorporating Aboriginal cultural safety defined by AHPRA. In relation to technology, initiate video consultations. Kota's 8-step change management model is used for change. Assessing change readiness and creating urgency come first. Develop a coalition with CEOs of RACGP, Medicare, AHPRA, Australian Institute of Health and Welfare, and AMC. Support from high level is essential for change management. Remove barriers or resistance to change. There are 12 change management issues planned. Implement change and have short-term wins to boost the employees. Short-term wins mean successfully completing a segment of the change management plan. Implement model of care for chronic disease. 6 elements of the chronic disease model are health system, clinical information system, decision support, delivery design system, self-management support, and community and resources. Implement best practice guidelines. Deliver a simple and strong CPD program and career and education planning in the practice. Change the practice into formal practice-based learning. GPs can supervise and support the teaching. Enhance telehealth with video consultation as mentioned before. Empower and engage patients in managing their own health under GP supervision. Develop a quality management plan and implement it. Review MBS items as the best practice and evidence-based. Remove the obsolete items. Reduce the waiting time for the patient. Patients get frustrated because of waiting too long. Induce review of Medicare for achieving the goal of effective coordinator of healthcare development and service delivery. Promote stewardship reform by Australian government, providing a legal framework for private sector for quality healthcare. Consolidate change and implement more changes. Ensure positive reinforcement and identify risks and develop risk management plan. Finally, anchor the change in the GP practice, providing positive reinforcement, implementing reward system, and showing stakeholders the improved patient's outcome. Acknowledgement. I am grateful to RACGP, Medicare, AHPRA, Australian Institute of Health and Welfare, AMC, and to those I referred to in this video. Thank you.